This big tube with flashing lights on it, connected to a couple of pulsating dongles, is an EMDR machine, and it can help men with sexual difficulties, including premature ejaculation and erectile dysfunction. But I'm careful in how I introduce this machine to clients, because if I just grab the pulsators and say, shall we give this a go then? They're like, actually, I think I'm alright after all. But EMDR is really not scary and not as bonkers as it may seem. EMDR stands for eye movement desensitization and reprocessing, and EMDR therapy is pretty mainstream these days. It helps resolve bad experiences, anxiety, and fears. 3 things that men struggling with PE or ED will know something about. For example, Glenn found it really difficult to last with his girlfriend. She was understanding, but he felt a massive amount of pressure, and the breathing techniques and the numbing sprays didn't make any difference. His doctor told him he had performance anxiety, and he did. And it didn't take much digging around in therapy to find out why. He'd lost his virginity a year ago to a girl he'd met in a club, and imprinted on his mind that night the immortal words that she said immediately after he'd come. Is that it? And this echoed in his mind and his body every time he had intercourse. It had become a self-fulfilling prophecy of premature ejaculation. Ouch. So what's my EMDR machine going to do about that? And what's eye movement got to do with it? If you've struggled to stay erect, or you keep coming a bit too soon, or the opposite, and it takes you ages to get there, and your partner keeps saying, God, are you done yet? Then you'll know that an expectation sets in, that it'll happen again next time. And then it does, because we're anxious about it. And we accumulate all these memories of us being rubbish at intercourse. So we want to get over this and not let our past keep dictating the future. And this is where EMDR comes in useful. As a therapist, if I just say, okay, well, try to forget about all that and let's focus on relaxation and how confident you can feel, that might seem a bit superficial. We don't want to dwell on the memory too much and make it more of a thing, but we want to do something to shift it, to file that memory away as a normal memory. And we can do this with EMDR in quite a unique way. You'll sit with the machine in front of you, so you can comfortably watch the light move back and forth, and you can follow it with your eyes. And you'll hold a pulsator in each hand, and it pulsates in sync with the light. Now bear with me here, because you don't just sit there watching the lights. We have a brief conversation about what happens that day, how the anxiety and the dread feels, the kind of things it has you telling yourself. And now and again, you'll picture all this while watching the lights. Now we'll gradually shift to what would be a more helpful way to talk to yourself about sex, about intercourse with your partner. Consider that. Watch the lights. Because there's something about bilateral stimulation, engaging both sides of the brain, that helps us reprocess memories. We're accessing it, experiencing it in a very different way to worrying or stressing over what happened. And our nervous system seems to take notice. The amygdala, that part of your brain that looks out for bad things happening again, seems to get the message too. Oh, this is different. Maybe I can let this go. Quite how this works is the subject of much debate. There's nothing magic about the lights or the pulsing. These side-to-side eye movements have a relaxing and absorbing effect, helping the reprocessing to happen. The effectiveness of EMDR is backed up by research, and it's recognised by the National Institute for Health and Care Excellence and the World Health Organization as a treatment for trauma. Prince Harry has used EMDR, not for premature ejaculation treatment, I hasten to add. So let's get back to Glenn and is that it? In an EMDR session, we might ask him to picture what happened that night. How does it look? How does he see it? Or is he in it? How does he feel? Does he feel anything anywhere in his body? Then he'll watch the lights for 20 to 30 seconds and reflect on that. Has anything changed? The picture or the feeling? If he was to rate the feeling, the anxiety or the humiliation on a scale of 1 to 10, where is it now? Then he'll watch the lights and we gently check in again. And what we'll see is a move in a less anxious direction. That rating will start coming down. Has anything changed? Look at the lights again. And we take our time with this. And we'll start to work with Glenn's self-talk. As the stressful feeling subsides, What might be a more helpful learning? We let Glenn reflect on that. Maybe I can enjoy being more present during sex. The pressure is lifting. I can take in the scene and the moment and actually focus on pleasure rather than going up into my head. Watch the lights on that. Can he picture having relaxed sex with his girlfriend? Can he hold this more positive message? How does that feel? Watch the lights, reflect on that. What's changing? What can he feel now? And we keep going with this momentum. The combination of the guided visualization with bilateral stimulation, so reflection plus a relaxing movement to focus on, can shift old memories in quite surprising ways. I've simplified this, and it might be done over a couple of sessions. There is a protocol to EMDR that should be followed, guided by a qualified professional. But I hope this gives you an idea of how EMDR works. Now, sometimes people say, okay, EMDR is a trauma treatment, but coming too soon in bed, that's hardly PTSD, is it? Fair point. EMDR is used for treating war veterans and people who've experienced abuse and all kinds of life-death situations. This is in a different league of trauma, we could say. But EMDR is equally appropriate for any experience that was embarrassing, belittling, shaming, confidence knocking, these things that lodge in our memories and bring on a feeling. Take the guy with erection difficulties ever since he was there for his wife giving birth. A wonderful, life-affirming experience, but with an unexpected image stuck in his mind that needed a bit of unsticking. Or for people who struggle to relax into sex because they're intensely uncomfortable with their appearance, their own bodies. Now, very often they've had experiences, sexual or non-sexual, that has made them feel this way. EMDR can help desensitize that. And if you're watching this and you're thinking, well, I struggle with PE or ED, but I haven't had an is that it moment or some specific event that triggered it. Well, yeah, that's perfectly possible for a lot of people. EMDR could be helpful for neutralizing those accumulated memories of experiencing the problem itself. Those memories of feeling so frustrated, embarrassed, hopeless even. Feelings that get stuck and then we keep bringing them with us back into the bedroom. And whether it's a specific memory like Glenn's or our general perceptions of our sexual ability, EMDR could be a part of therapy, along with assessment, teaching sexual skills, communication confidence, and relaxation techniques. Are we going to take a guy with PE or ED and just sit him in front of the lights and ask him to think about not having PE anymore and woo, problem solved? No, that would be like 1,000 to 1 placebo effect. EMDR reprocessing work could be a potential part of his therapy to help target the negative thoughts and memories. And a lot of people who have successful sex therapy for these issues, they never go near an EMDR machine, of course. It's a good potential option in the hands of a therapist who knows what they're doing. And there are alternatives to EMDR too. See my video about the rewind technique. It's doing a similar kind of reprocessing. Where to find out more about EMDR and finding a therapist? If you're in the UK, Counselling Directory includes EMDR as a search option. And there's also the EMDR Association UK website and IMDRIA, the International Association website too. Links in the description. And as ever, check that your qualified EMDR therapist has experience in working with sexual issues, because they should offer an assessment and they should agree with you on a plan. So I hope this has been insightful and thank you for watching.